Cholesterol levels refer to the amount of cholesterol present in your bloodstream. Cholesterol is a waxy, fat-like substance that is found in all cells of the body. It is essential for the production of hormones, vitamin D, and substances that aid in digestion. However, high levels of cholesterol can increase the risk of heart disease and other health problems. Cholesterol levels are typically measured through a blood test called a lipid panel or lipid profile. This test provides information about various types of cholesterol and other fats in your blood. The key components measured in a lipid panel are 1. Total cholesterol. This is the sum of all types of cholesterol in your blood, including both low-density lipoprotein, LDL, cholesterol, often referred to as bad cholesterol, and high-density lipoprotein, HDL, cholesterol, often referred to as good cholesterol. 2. LDL cholesterol. LDL cholesterol carries cholesterol from the liver to the cells of the body. High levels of LDL cholesterol can lead to the buildup of cholesterol in the arteries, increasing the risk of heart disease. 3. HDL cholesterol. HDL cholesterol helps remove excess cholesterol from the bloodstream and carries it back to the liver for processing and elimination. Higher levels of HDL cholesterol are considered beneficial because they help reduce the risk of heart disease. 4. Triglycerides. Triglycerides are a type of fat that circulates in the bloodstream. Elevated levels of triglycerides can also contribute to heart disease. The recommended cholesterol levels may vary depending on individual factors such as age, gender, and presence of other health conditions. In general, desirable cholesterol levels are: total cholesterol, less than 200 mg per deciliter, milligram DL. LDL cholesterol, less than 100 mg per deciliter, optimal, or less than 130 mg per deciliter, acceptable. HDL cholesterol, 60 mg per deciliter or higher, considered protective, or 40 mg per deciliter or lower, considered a risk factor for heart disease. Triglycerides, less than 150 mg per deciliter. It's important to note that these are general guidelines, and your doctor will consider your overall health, medical history, and individual risk factors when interpreting your cholesterol levels.
To start, let's dive into how to create a marketing plan outline and then take a look at what a high-level marketing plan outline has inside. So, what do you say? Are you ready to give it a spin?
High cholesterol levels can be influenced by several factors, including 1. Poor diet, consuming foods that are high in saturated fats, trans fats, and dietary cholesterol can raise cholesterol levels. These fats are commonly found in fatty meats, full-fat dairy products, fried foods, processed snacks, and baked goods. 2. Obesity, being overweight or obese can contribute to higher cholesterol levels. Excess body weight, particularly around the waist, can lead to increased LDL cholesterol and decreased HDL cholesterol. 3. Lack of physical activity. Regular physical activity helps raise HDL cholesterol levels and lower LDL cholesterol levels. Leading a sedentary lifestyle can contribute to imbalanced cholesterol levels. 4. Smoking. Smoking damages blood vessels and lowers HDL cholesterol. It also increases the risk of heart disease and decreases the body's ability to handle cholesterol effectively. 5. Genetics and family history. Some individuals have genetic conditions that cause them to have high cholesterol levels regardless of their lifestyle choices. Additionally, if close family members have high cholesterol or a history of heart disease, it may increase your risk of having elevated cholesterol levels. 6. Age and gender. Cholesterol levels tend to increase with age, and men typically have higher cholesterol levels than premenopausal women. After menopause, women's LDL cholesterol levels tend to increase. 7. Certain medical conditions. Conditions such as diabetes, hypothyroidism, kidney disease, and liver disease can affect cholesterol metabolism and lead to higher cholesterol levels. It's worth noting that while diet and lifestyle choices play a significant role in cholesterol levels, some individuals may have a genetic predisposition that makes them more susceptible to high cholesterol. In such cases, lifestyle modifications may not be sufficient, and medication may be necessary to manage cholesterol levels effectively. If you're concerned about your cholesterol levels, it's important to consult with a healthcare professional who can evaluate your overall health, assess your risk factors, and provide appropriate guidance and treatment options. Low cholesterol levels, specifically low levels of LDL cholesterol, can be caused by various factors, including 1. Genetic conditions. Some individuals may have genetic disorders that cause unusually low cholesterol levels. For example, familial hypobeta-lipoproteinemia is a rare genetic condition characterized by low levels of LDL cholesterol, and apolipoprotein B, a protein. 2. Malnutrition or malabsorption. Inadequate intake or absorption of nutrients, including fats, can lead to low cholesterol levels. Conditions that affect the absorption of dietary fats, such as celiac disease, Crohn's disease, and certain liver or pancreatic disorders, can contribute to low cholesterol levels. 3. Hypothyroidism. An overactive thyroid gland, hypothyroidism, can cause low cholesterol levels due to increased metabolism and accelerated breakdown of cholesterol. 4. Liver disease. Severe liver disease, such as cirrhosis, hepatitis, or liver failure, can lead to reduced production and clearance of cholesterol, resulting in lower cholesterol levels. 5. Malabsorption of cholesterol-lowering medications. Certain medications used to lower cholesterol levels, such as statins, can interfere with the absorption of cholesterol in the intestine. This can result in lower cholesterol levels. 6. Hypercatabolic states. Conditions characterized by excessive breakdown of body tissues, such as severe burns, advanced cancer, or hypermetabolic states, can lead to decreased cholesterol synthesis and low cholesterol levels. It's important to note that low cholesterol levels are generally not a cause for concern on their own, unless they are associated with an underlying health condition. Cholesterol is an essential substance for the body, and extremely low levels can sometimes be associated with health risks, including an increased risk of certain infections and bleeding disorders. If you have persistently low cholesterol levels or any concerns about your cholesterol, it's advisable to consult with a healthcare professional who can evaluate your overall health, identify any underlying causes, and provide appropriate guidance and treatment if necessary. Disadvantages of cholesterol level. 1. Increased risk of heart disease. High levels of LDL cholesterol can lead to the formation of plaque in the arteries, a condition known as atherosclerosis. This buildup of plaque can restrict blood flow to the heart, increasing the risk of heart disease, heart attacks, and strokes. 2. Risk of cardiovascular complications. High cholesterol levels can contribute to the development of various cardiovascular complications, such as coronary artery disease, angina, chest pain, peripheral artery disease, and carotid artery disease. 3. Increased risk of blood clots. High cholesterol levels can promote the formation of blood clots, which can block blood vessels and lead to serious complications like deep vein thrombosis, DVT, or pulmonary embolism. 4. Hypertension. High blood pressure. Elevated levels of LDL cholesterol can contribute to the development of hypertension, a condition that strains the heart,